This is Dr. Amelia Bueche, founder of This Osteopathic Life for the health of all things. As a specialist in neuromusculoskeletal medicine and osteopathic manipulative medicine, I have dedicated my professional career to the study of the intricate design of the human body and understanding how the structural components, nerves, muscles, and bones can influence the function of the entire system. Quality movement directly relates to quality health, and it's important to have the right tools for optimal strength, flexibility, and mobility. Through these videos, I lead you through clear and concise exercises that you can use to find optimal health through movement. It is important to note that while I am a physician, these videos do not constitute medical advice, nor do they replace the important relationship between you and your personal physician. Before beginning any exercise plan, it is important to consult with him or her to ensure these are the right exercises for you, your particular diagnoses, and your current state of health. Thank you for joining me, and let's get started finding best health through movement. In today's episode, I'll be covering stretching exercises for the major muscles of the lower extremities. This is important as we spend a lot of time sitting, and these muscles can become tight, and they can cause inhibition of other muscle groups in the body. That can also lead to pain in the low back. So by stretching the muscles of the lower extremities, we can improve some of our chronic low back pain. The first we're going to do is a hamstring stretch. And for this one, what you're going to do is take the heel down and toe up of one leg. So you're taking one step forward there, and we're going to sit back, hinge back with the hips, keeping the chest tall and proud here until you feel a stretch along the back of the leg. And you can see I've allowed my back leg to bend just slightly to allow me to make that movement. You might feel the stretch in your calf, you might feel it directly behind the hamstring, but you should feel engagement in the back of the leg whose toe is up. We want to stay here in this hinged position. We don't want to lean forward and reach because we're trying to really get to the attachment of hamstring on your sit bone. Okay? So sitting back, hinging back here for the hamstring, coming forward, and doing the opposite side. We like to hold that stretch for at least a minute to really get into that muscle group. We'll also stretch the psoas muscle, which is your hip flexor. It's short when you're seated, and it's lengthened whenever we step behind, bring that leg behind the plane of the body. And it might just be that, just taking a step back to start, and you already feel a stretch in that muscle. To enhance the stretch, you can step back even farther and begin to allow that front knee to bend. You can also sit up taller, really bringing the chest tall and proud, and also tuck the pelvis under. That helps isolate into the hip flexor muscle. If your calf is too tight, you can also do a kneeling version of this stretch and really work on coming up tall and opening through the angle of the hip there. We'll also stretch the side of the legs, the iliotibial band, the IT band. And to do that, the leg that I want to stretch is going to stay in the back, and I'm going to step over it with my other leg. And then the arm of the leg that I'm stretching is going to come up like a ballerina and lean to the side. It gives me leverage here. Okay? You might feel that stretch up at the hip or down near the knee. It's one continuous piece of tissue, and wherever it's tightest on that day is where you'll feel it. You can add just a little bit of a forward bend. So if you're in this lateral position, you could hinge forward a little bit at the hips, but the majority of the motion should come with driving that hip out to the side. Okay. We'll also stretch the quads, our squatting muscles, and to do that, we'll reach back and grab one foot. If you need to, you can stand where you're supported, reach back and grab that. An alternative would be to put the toe up on a surface. Okay, so I have my support structure here. I can bring the toe up, and you can start with a lower surface, maybe an ottoman, something to that effect. And you can dip down, so bending the opposite knee allows me to get more out of that stretch. You can also get closer to the source, to the implement that you have your foot up on. Usually lowering that knee will enhance the stretch, and then you stand tall, take that foot down, and repeat. We noted that both in the hamstring and in the psoas or hip flexor stretch, our calves sometimes can feel tight, and they can get into the way of getting a complete stretch. So we can use a runner stretch to address the calf directly. And for that, I'm going to use this stool so I stay in the frame. You can also use a wall so that you stay more upright in the torso. If you do use something lower, make sure you're hinging at the hips. Okay, I'm not reaching down like here to stretch. I'm keeping the chest tall and proud, and then I'll step back with my calf. And I want to do one version with the heel down and the leg straight, one version with the heel down and the knee bent. So you can see I'm not getting my foot heel all the way down with that. Do your best. Okay, legs straight, knee bent, both versions there, leaning forward. For all of these stretches, you want to hold for at least a minute for each stretch for each leg. You can use your breathing, and on every exhale, see if you can sink a little deeper into each stretch. You could use these a few times throughout the course of your day. Thank you. Thank you for joining in on this episode of This Osteopathic Life, Best Health Through Movement. This is Dr. Amelia Bueche, and we'll see you next time.